of our speakers, if everybody would mute themselves. This meeting is being recorded, by the way, and will be posted to our website along with the recap. So look for that. Welcome to the June 30 San Francisco Public Relations Roundtable's second virtual event on PR's front lines. I'm going to get rid of that. Okay, let's see. I am Molly Walker, Walker Communications, Oakland, California, and I am 2020 Roundtable Chair. We're so pleased you're with us today, all of you. This is a wonderful turnout. You know, it's just great. And we have about 50 people here with us today. At Roundtable events, I'll just say this, we try to offer a door prize for attendees. So even though we don't have a virtual door, we are going to award a door prize of a $35 gift certificate to Green Apple Books when we're done today. You're encouraged to post your reactions to today's event to social media during and following our program. The Roundtable handle is SFPR Roundtable or hashtag SFPRRT. We'd love you to do that, post pictures and comments. Also, we have a big program today, so let's get started. I am going to introduce quickly our people who are speaking with us and who are going to be interviewed by Sarah Segal. First is Kristen Bole, who you all have just met, who is the Director of Clinical Communications and leads a team of communications and media relations professionals, including our own member at UCSF Clinical Enterprise, UCSF Health, which includes UCSF Medical Center and UCSF Benioff Children's Hospitals and other Northern California affiliates. Kristen joined UCSF in 2007, and after nearly 20 years of experience in business, journalism, executive staffing, and health and science PR. Her career has taken her around the world, including a stint helping start up a business newspaper in Bangkok and a lot of other things. But I thought that was, for me, that was pretty wild. Randy Quezada joined the Port of San Francisco in February 2019 with responsibility for the Port's media relations, marketing, community and stakeholder engagement programs for the 7.5 miles, you all know that, of San Francisco's waterfront from Fisherman's Wharf to Islay, I'm not sure that's right, Islay Creek and Bayview Hunters Point. Randy, you can let me know if I got that right. He also worked in communications and community relations for the San Francisco Department of Homelessness and Supportive Housing, in addition to Pacific Gas and Electric Company, the Office of Economic and Workforce Development, UCSF, and the New York Department of Homeless Services. And I also understand he is fluent in Spanish. True? Yeah. Francis Zamora is the Director of External Affairs for the San Francisco Department of Emergency Management, where he is the department's spokesperson and leads the External Affairs Unit, which includes managing the city's joint information system during an event or emergency. Francis was previously a public affairs consultant for the Thayer Group, I hope I'm saying that right, provided public affairs services for Nolte Associates, which is a civil engineering firm. And he was chief of staff for a San Jose City Council member. He also served in the US Marine Corps as an intelligence analyst, and he immigrated to the US from the Philippines as a child. Sarah Segal, who is my colleague, our moderator and a PR Roundtable member and board member and membership chair, is the founder of Segal Communications, a Bay Area-based public relations agency that helps brands tell their most meaningful stories. Sarah is a member of the Forbes Communications Council and previously served in the marketing and communications and media relations roles at a number of agencies and firms. She was an on-air reporter with KRON TV, CNY Central, and WIVT WBGH, News Channel 34. And now, on with the show. Take it away, Sarah. Thank you.
Thanks, Molly. For anybody who's listening in, if you have specific questions as we go along, I do encourage you to put them in the chat channel. Molly will be kind of watching those and collecting those for after our initial questions. So thank you so much to Kristen, Francis, and Randy for joining us today. I'm excited to get this conversation going. Kind of want to just start off with a basic question. Francis, maybe we could start this off. When did COVID kind of land on your radar this year? And when did you realize that it was going to be something quite substantial to contend with?
Hey, thanks for that question, and good afternoon now, everybody. So really, San Francisco's response to COVID-19 started back in January, and so a colleague of mine at the Department of Public Health had reached out, I think it was January 21st, and said, hey, we're tracking this virus out of China, that we need to start putting together some public education campaigns. We need to start monitoring what's going on. And so it was really that early effort, especially with San Francisco's large Chinese American and API community, that we started doing a lot of public education and outreach about the virus, which really nobody knew much about. We were tracking it, we were still learning about it. And a big part of that challenge was also fighting the xenophobia, which was becoming prevalent. We were seeing kind of things on social media as well as within the traditional media about incidents taking place. And so that was a big part of the early effort. Where it became real, it wasn't when we declared an emergency or it wasn't shelter in place. It was probably about a week before then when they first started talking about implementing social distancing protocols, where I was kind of like in my head, oh, wow, we're really doing this. We're really asking people to stay apart. We're really limiting large events. This is really going to be a huge impact on the lives of not only San Franciscans, but the entire Bay Area. And so that was certainly a surreal moment for me. There's a lot of moments throughout this response, but that would be the one where our director said, hey, they're starting to talk about social distancing and really putting these things into place.
Kristen, that happened a little bit later for you. And I think we spoke earlier, you mentioned Super Bowl Sunday being kind of a kicking off point for bringing it into your focus.
Yeah, so UCSF has a long history of leadership in infectious disease research and care. So we actually started getting calls, I think mid-January, for just expert opinions on this strange new coronavirus. What is a coronavirus? And so it was really research focused in the very beginning stages. But our hospital actually started to prepare in mid-January and started that ramp up. So it was definitely on our radar at that point. And we actually opened our hospital incident command center on February 2nd, which was Super Bowl Sunday. And we got our first patients the next day. So we opened the Hicks, not realizing that we were about to get patients. So it really did affect us early.
And Randy, you were a little bit, am I right to say that you were a little bit later in this, in that your kind of first frontline dealings with it came along with a particular cruise ship that was trying to dock in the Port of San Francisco?
Well, it's interesting how these things evolve, and you start to think about when was you start to really pay attention to what's going on. Well before that cruise ship issue that we're all intimately familiar with, we're all kind of tracking what's going on, right? Francis mentioned here in San Francisco, we have a large Chinese American community. There's good, strong ties to Asia, to China, and we're watching this like, oh man, that sounds not good. And then, things are starting to progress. You're keeping an eye on it and being like, I wonder what's going to happen if it comes here. But it doesn't, right? And it's kind of a slow build. And I really started to pay attention when the other things that were happening with cruise ships in particular in the region. Thinking specifically around Port of Yokohama in Japan and the Diamond Princess. Princess Cruise Lines is a partner of the Port of San Francisco. They're home ported that vessel, not the Diamond, but the Grand Princess here. So I really started to pay attention. And then, my good friend Francis started to reach out about the launching of the JIC, the Joint Information Center. And that was the time I was like, oh, okay, something's going on, and we need to get prepared and be ready. And, I love working with Francis, but when you get these emails about, hey, we all got to meet and start getting together, it kind of ramps things up. So that's when I really started to pay attention. And of course, as we're looking at events unfold throughout February with the Port of Yokohama and what was going on over there, and then our own experience with the Grand Princess, I knew quickly, oh, dude, we're in. And then everything that happened in March really solidified that this is going to be a long-term response, and we have to get ahead of it and be prepared for this.
Were you able to, did you feel like you were able to well prepare for the kind of media questions that you started getting peppered with as this started developing, or was some of that information kind of the back and forth where you were getting the information as you were being asked the questions?
So it was kind of a slow build, right, for us, right? You know, we're looking at the experience at the Port of Yokohama and what's happening, and we're taking a look. And, okay, it's the Diamond Princess, Princess Cruise Lines. So we get small inquiries. Hey, you know, what cruise partners does the Port of San Francisco work with, et cetera? You know, kind of like, just tell us in general about the cruise business. Sure, you know, we're happy to talk about that. We're ready to talk about that stuff at any point. In fact, you know, this year was supposed to be a banner year for cruise in San Francisco. This was the year that we were going to have the greatest number of cruise ships coming to call on the Port of San Francisco and, you know, and do everything that happens. But that didn't happen. You know, the world changed, you know, and we have to be ready and flexible and adapt. So, you know, kind of as we're watching that experience in real time, we're kind of, you know, boning up on our own sort of knowledge base around the cruise business, getting ready to ramp up. What we didn't know was this situation with the Grand Princess was going to land, you know, just a couple weeks later, which is ultimately what happened. And, you know, you lean on your partners, whether they're in other departments, they're internally, to prepare, you know, all the fact sheets, all the information that you have to be ready to proactively respond and also reactively. You know, there's a good give and take with the media, and so much of this stuff is happening here locally, but also in other places. You know, we kept hearing about, oh, well, there's some other vessel somewhere else on the East Coast, or there's somewhere else, you know, in Asia or in Europe or something. You know, some of this stuff was rumors, some of this stuff was not confirmed, but this was a growing thing. So we need to get ahead of kind of our own thinking and our own planning process for, well, what if? You know, how would we respond to a situation and be prepared to respond?
Kristen, how do you said that you got your first 2 patients pretty quickly after you set up your command center. How do you find that balance between providing you know, media and the public information, but also maintaining that privacy of those patients and the families, and quite in fact, the stigma associated with having COVID-19?
Yeah, that was a big issue with this, especially since, I mean, we got to remember that San Francisco was really at the front, on the front lines of this in the early days. People thought that we were the ones who were going to become the New York. We were going to be, I mean, we would be sitting around in the Hicks, and I mean, honestly, our leadership was really nervous. They were watching Italy and saying, we're a week away from Italy. We are going to have, I mean, we're going to have a deluge. And so because we were so, well, okay, I'll step back and answer your question more appropriately. So I think that in the earliest days, there were so few patients and all eyes were on us. So immediately people started trying to hunt around and find out where those first 2 patients went. Mm-hmm. And they did come to us, and we had to really struggle with, you know, what is our role in patient privacy and what is our role in the public service to reporters? Because technically, you know, if there's an airplane crash, we can say, yes, we took 2 patients, and, you know, give a one-word answer. But in this case, you know, to Francis's point, there was so much racism and there was so much stigma around this that, you know, those patients came from a very small community. And we felt that simply by admitting that they were here with us, would expose their identity. So that, you know, we really struggled with that in the very early days. And then we had to figure out, well, you know, at what point do we stop telling reporters you really have to go to DPH to find that out? And it, you know, it sort of reached a critical mass that we could start saying, yes, we have 10, yes, we have 12, we have 15 patients.
Francis, when you talked earlier about, you know, getting the word out and educating people and starting a campaign in terms of educating people about, you know, the distancing and stuff. How do you do that effectively in San Francisco when we have such a diverse grouping of people? I mean, we talk about San Francisco and the Bay Area having microclimates. We certainly have microcultures as well. How can you tackle all of those groups effectively?
Thank you for that question. I think there's numerous ways we've done this. Number one, we wanted to make sure we had partnerships with the community early. So one of the things, and I should note why I'm wearing a mask. I am in San Francisco's Emergency Operations Center. It's over here at Moscone Center. So I am around my social bubble of 400 people daily. So we do have masking requirements here in the EOC. So if anyone was curious about that. So one of the things that we have in San Francisco is we've developed a community branch in our Emergency Operations Center. And so it's making sure we have community partners from the faith community, from neighborhoods, from the private sector here that are part of our response. There's certainly an operations and planning component to that, but there's also a public information and community engagement piece. So when we're thinking about how we engage San Francisco's diverse populations, we also have to, we want to make sure that we're planning with the community and not for them, right? We also embedded an equity officer in San Francisco's emergency response to make sure that everything we're doing, whether it's operations, planning, food distribution, public information, has that equity lens, that we're thinking about all of San Francisco's communities. One of the things I'm also very proud of here in the Joint Information Center is that we have a very robust translation unit. In addition to Chinese, Spanish, and Tagalog, we also do translations in Arabic, Russian, and Vietnamese. Our translators work very hard to make sure that all of our public information is accessible, that it's translated and culturally competent in language. I'm also I think I would also say they've been a leader as well. One of the things I'm most impressed with is, you know, not only their hard work and making sure that these mounds of materials are translated, but they've also taken the initiative to create a translation glossary that is very specific to San Francisco, our local terms, as well as very specific to the COVID-19 response. You just can't get a translator from anywhere to be able to communicate about this effectively. Mm-hmm. And they've really, when they showed me the glossary, I was thinking, oh, maybe there's a couple dozen words in here. There's like more than 600 words in here that they've put together as a resource, and we made sure that was available to our partners and our public information officers as well, so we can get the most accurate translation available.
Is that a growing document? Is that something you're constantly adding to?
Constantly adding to. It is a Google Docs. Happy to share it with the group. It's not anything that's secret, but we want to make sure that we have very accurate communications that make sense for our local population.
Sure. Randy, when putting that information together and getting it ready for public consumption and media consumption, is part of that the importance of having people play by the rules and follow the right protocols in terms of giving you that information. When you were dealing with the cruise ship coming into the bay, were you getting information based on the protocols that were set out in terms of them telling you what was happening on the ship, or was it tough to get information to keep everybody updated?
It was such a fast-moving situation, and you had partners all across the country, all across the world, even to some extent, insofar that communicating with the actual vessel where it was at a given moment sometimes was difficult. And, we were communicating internally, so there were lots of moving pieces. And for me, what was most important was accuracy, timeliness, and being able to, follow through with sort of whatever commitments we were. I didn't want to get ahead of anything that we weren't able to, things that weren't verified. I wanted to be very, very sure that what information we were putting out was accurate. Now, information was growing and changing throughout the incident, if you will. We got more and more information as things proceeded. So the more, if we needed to go back and say, actually, things are different now, we know more, that's what we would do. But what was most important for me at the time was to make sure that we were providing accurate and timely information. And it got to a point where we were getting a lot of requests for information, a lot of requests for interviews and things like that. So we needed to make sure that we were all coordinated and tightly aligned on what was going on. So that was setting up daily, regular meetings with people, with all the various stakeholders, whether, you know, it was with Francis, at the JIC, with all the other city partners, so they were aware of. Simple things like the Port of San Francisco doesn't have any cruise lines, any cruise vessels that go back and forth from Asia, just making sure that we were all understanding of what that meant, because in the beginning, that was a very important piece of information that we wanted to share with the public, insofar as there was a lot of concern that we had vessels coming directly from China, from the impacted areas in Japan and so on. So we wanted to make sure people understand that was not the case. We have vessels that go up and down the West Coast with international ports in Canada and Mexico. At the time, that was a hugely significant and calming fact for the public and for the media. But as the pandemic really grew into a global pandemic, you know, people's perceptions change, and information matters. So as we are learning more, you know, it was important to, again, keep coming back out and providing the public with accurate and timely information as best we had it. You know, we were thinking, you know, on day one, well, this is what I understand to be true. And then by day three, I'm taking a look at, say, hey, you know, I think something's different. We need to round up everyone to make sure that we have the full picture of what's going on, because the public is looking for that. And if we needed to provide new information, more information, we did. If we had to push people to some of our other partners, whether it was the cruise lines or other departments, we had to do that as well. Again, right, for me, you know, being accurate, being timely, being transparent was so important, especially at a time when there was so much that's unknown and people are fearful, you know. And I think that you know, doses of truth and accuracy really help calm people's nerves. You know, I remember I got a call from someone who lived near the cruise terminal who said, you know, lots of, you know, terrible things about people, you know, speaking to the xenophobia about people from China, people of Chinese descent here in the city. And, you know, I understood this is coming from a place of fear and concern, but at the same time, we have to address this. Like, this cannot go sort of, you know, unsaid and unmentioned. You know, one of the things that makes the Bay Area such a wonderful place is that it's so diverse, and we take pride in our diverse communities from wherever people hail from. We are that city on a hill where anyone can come here and contribute and make the city bigger and better. So being able to address that, help to calm the fears, to me was really important. So the more timely, the more accurate information we could provide, the better, because I thought that was so important to helping to calm some of those fears in the community.
Kristen, you mentioned that kind of say, because you're such a hub for information, not just here in the Bay Area, but also nationally because of your history and your expertise in infectious disease. How did you put anything into action where it would save you a little bit in terms of having to repeat the same answers? I know there were a lot more questions than answers at a certain time, but like, did you put anything into action that kind of helped get that message out to a broader audience?
We did. Just to give a little perspective, I mean, for us, things changed on an hourly basis. And I think every news organization scaled up to cover COVID. So I think the Chronicle had 10 reporters on it, and there were 3 of us taking calls. So all 10 of them were calling us 3 times a day. I mean, it was crazy. At one point, one week we had 2,300 news stories that included us and COVID, nationwide and worldwide. So it got overwhelming really, really quickly. And so we did a few things. I think one was, in the very early days, our specifically infectious disease experts were being inundated with calls. And we realized really early that, you know, we've got to get this information out in a different way, because that, those two people can't take all of these calls. So we actually interviewed our experts on, what is coronavirus, how does it spread, what is, et cetera, the science of coronavirus. We posted that on our website on February 13th. And within a couple of days, it had hit 100,000 page views. In the following 4 months, that and the other stories, I'm just looking at my little data points here, hit 2.4 million page views, which, just for perspective, is more than we got on our entire website all of last year. So there was a huge hunger for it. And at one point, actually, we were trending higher than the CDC in page views and on SEO. So it was pretty significant. So that actually did help. It kind of hurt as well, because more and more people came to us. But we also created a couple of, really basic things. We had an FAQ, and that's a fancy name for it. It was a list of the questions we were being asked constantly, and just, like dashed out the best response we could have. And then we tried to, change that and update it on a regular basis. We also prepared an experts list. And this was an opportunity for a lot of our more junior faculty to get a chance to speak with media and get some media experience, because the senior faculty were just completely overwhelmed. And then we also had in our back pocket Bob Wachter. Bob Wachter is the chair of our Department of Medicine, and his wife happens to work for the New York Times, and so he's very media savvy, and he started a Twitter feed, and that has been, I don't know how many follows he has now, but that has been amazing in just getting really basic scientific news out on a daily basis. So it's really been a group of, a spectrum of different approaches.
Thank you for that answer. Francis, I would love to hear you to share a little bit about kind of the learning curve and the changes that you made in terms of those traditional press conferences. Obviously, that it became an impossibility at one point. You mentioned to me when we talked earlier about putting markers on the ground for reporters. Talk to us a little bit about kind of how you transitioned to a little bit more of a safer means of getting information out.
Sure. I think, first of all, especially here in emergency management, we had been training for this big event for a long time, right? But it was supposed to be the earthquake. It wasn't going to be a global pandemic. We were training for the big one. And so while we had a game plan, and we certainly had a pandemic plan, putting into practice and realizing what that really meant challenged a lot of what we had. So sure, certainly we had press events, press conferences that were taking place, and early on in the traditional format. As we learned more, we had to kind of institute like the 6-foot rule, right, with the reporters and with the speakers as well. And that meant putting X's on the ground and where the reporters could stand, where the camera people could stand. As things got more strict, we moved on to the virtual press conference. And that's something that we did on a near daily basis for, I think almost like 3 months, where we would host San Francisco's virtual press conference 3 times a week. People would log on to WebEx. We were using WebEx, I think, for that. Reporters would submit their questions online. I was the mysterious voice from like the Voice of Oz that would read the questions to the mayor, to the health director, to the other city officials. And so if you can imagine being in a traditional press briefing room, completely empty of press, up on a riser with your American Sign Language translator, with the speakers off to the side, and just kind of looking at the screen and reading the questions. Thankfully, I had a very great staff of people from the Joint Information Center that would field the questions from the press, kind of go back and forth with them to really narrow their questions and make sure that it was very clear on what they were asking and what they were looking for. And I actually put a lot of trust in them. I like to joke with them that, if you put it up on the screen, I'm going to read it. So, it was almost that Ron Burgundy moment, if you put a question mark, I'm going to answer it as a question, say it as a question. So certainly learning from that. And really, there was so many iterations of that virtual press conference. It was something that we had not expected. Now, certainly as we've transitioned to opening, trying to get into that groove of where we have reporters in person was a transition. I got to say, I think the very first press event we did, this was when we were starting to reopen outdoor dining. We did an event out in the community, and you could almost sense the excitement from the reporters in the community to actually see each other again. And but they had come up with all these different innovations. I remember a reporter from KCBS had a PCB pipe, with their mic on it, so they can kind of extend out and boom, and talk to a reporter, talk to the speaker. And so certainly has challenged the way we think about things. But part of that is just being able to think on your feet and having a great team. Randy was there during the early days and helped us work through a lot of this. So I got to give a shot to Randy for being there for us early on.
So I would love to be able to jump into questions. So I encourage everybody to put questions in the chat channel now. I want to ask one more question before we move over to that, and I'll let Molly work through those questions. But talking about obstacles, and I'm happy to hear any of you respond to this question. Homelessness, what did you, in terms of the challenges of dealing with that segment of the population on top of all of this, was it something that was just, how do you approach something like that?
Let me unmute myself here. Great. So homelessness is certainly a challenge that was here before COVID-19 and has only become more complex because of COVID-19. And so really understanding, what we can do to mitigate the impacts of the virus on our homeless population was something that evolved over time, that really took a lot of resources, and make sure that we had a great commitment from all of our partners. And so, I have in emergency management, especially in my PI role, I have like a Rolodex of PIO friends that I like to call when things go down. And Randy is certainly one of those people. And so I know Randy was one of the very first calls. I said, hey, Randy, we really need some help here, developing a communication strategy and really just fielding the flood of questions we're getting on how San Francisco is dealing with homelessness in kind of the COVID-19 environment. And so I would say it's an issue that's always evolving. It's an issue that just has really gotten more complex in this global pandemic.
All right, so I'm going to pass the baton to Molly so she can go through a couple questions. But while she's doing that, I'd love you to think about the question of kind of what we're preparing for. It's a holiday weekend coming up. People like to gather. There is this kind of, we're in an in-between places where, are we opening up? Are we shutting down? Are we staying apart? Are we getting into bubbles of people that we believe to be healthy? Kind of how are your different organizations preparing for that? So think about that while Molly asks a couple of the questions that came in through the chat.
Okay, hi, yeah. So Ethan Veneglassen, this is a great question. Most aspects of the COVID response are being led by government agencies, and yet trust in government is at an all-time low. Given this, what do you do? There's sort of two parts here. Given this, what are you doing to ensure you are able to communicate credibly and effectively? And to what extent have changing policy directives from the state and federal government impacted your strategies? Can you respond to that, any or all of you? Thanks.
I can respond at least to part of it. I think that in some ways made our role even more important, which is that, we have 2,500 roughly experts here, and they're scientific experts, and they are people who do have credibility. And so, you know, especially as other hospitals start, as the federal government was, let's say, having some difficulty with messaging, but as other hospitals were telling their physicians not to speak, you know, not to say anything. There were many hospitals nationwide that were saying, forbidding any of their staff to speak with media. It made it really important for us to step up and to really be there. And we felt a huge, I mean, really, we really felt like it was our mission to answer every single media call and provide the expertise that they needed.
You know, on that note, Sandra Stewart had a question, which is kind of interesting, I thought, which was, how did you approach it when you needed to correct prior information you'd given? Now, maybe this didn't happen, but due to the fast-moving situation without compromising your credibility.
I'll jump in again, but please, others jump in too. So, you know, we work really hard to develop relationships with reporters. And I think that in general, I mean, there were a lot of new reporters working on this who we'd never worked with before, but in general, I think that they pretty much trust us. And part of that trust is based on our, you know, if we got something wrong, we pick up that phone so fast and we say, hey, that number was wrong. And we, you know, there's no ego attached to it. We want to make sure they can get the best story that they can write. So I think they know that about our team. So
And I would echo Kristen's point. I mean, certainly in such a fast-moving situation, you provide the best information you have at the time, and being able to have honest conversations with reporters about that, especially with reporters that you've developed relationships, good or bad, over time, and just being upfront. Hey, this is the correct information now. We gave you the best information we had at the time. Please, you know that this is what we know now.
I think it's important to stress that it's what we know now, right? And I think just as much as we are going through this, you know, on full display in record time, everything is constantly evolving and changing. So it is for them too. And they understand that more information may be coming down the pike. You know, the guidance may change tomorrow from what it is today. And as it does, we need to adapt to it. You know, we cannot be beholden to something for the sake of consistency if it's no longer accurate. You know, being able to provide, you know, that clear, accurate information is, I think, the key to building and maintaining those relationships, because that's where the trust is going to come from. You know, whether you have to call back and say, hey, I have more information, or, you know what, that number was wrong, whatever it is, you need to be able to pick up the phone or turn on the Zoom as it is more and more now, and do that. You know, but I think that understanding that kind of on both sides, things are changing quickly. I don't have everything right now as much as I would love to. I don't, but this is what I have for you now. And when I have more or something different, I will come back. And being able to follow through with that is key.
I have a question that sort of is we're changing the course of this a little bit, but the other thing that happened, of course, is the kind of horrific, besides the crisis in the pandemic, the deaths of George Floyd, Breonna Taylor, Ahmaud Arbery, and Rayshard Brooks. I mean, that was really a horrific thing. And Black Lives Matter demonstrations and the great outpouring, we all know this, of grief and anger, and you know, it was just distressing and horrible. And I guess the question though for all of you is that, so how did you cope? I mean, were you affected at all? I mean, in terms of kind of your operation, what you had to say, certainly with the homeless community, with the city, with everything. Do you have any comment? I mean, sort of how you sort of braced yourselves for what would happen next?
I'll start here. I mean, there's certainly how everyone personally feels about things, right? And it's really having the opportunity to process that, but also understand that you have a job to do, and that you have to act professionally and do what you need to do to make sure that the public has the information they need in order to stay safe, to make the right informed decisions. And so one of the things I know that we did when when we were, obviously with the tragedy of what happened to George Floyd and the resulting civil unrest, is we ended up breaking off a piece of our emergency operations center and our joint information center to go back to our original Department of Emergency Management headquarters to help manage that response. And so it's identifying the resources, getting them over there, and quickly coming up with a plan to make sure that that the city's message gets out, but also that we're giving people the information they need. And so during that time, I remember it well. I had actually just started some mandatory time off. I had been working for a long time. They said, Francis, you need to take a week. And then got a call on Saturday saying, hey, you've got to come in. This is going on. We need to make some announcements, which ended up being the curfew, right? And so I remember that very well. Many of the equipment and resources we needed to conduct the press conference were at Moscone Center at City Hall. Well, that's right in the middle of where a lot of the demonstrations were taking place. So there was no real way to safely get that equipment over here. And it came down to, well, I have my phone, we're gonna Periscope this. And we ended up making that announcement, over Twitter on Periscope and coming up with that on the fly. We started a whole new operation, made sure that we had the resources there, but it was certainly one of those things where you had your personal emotions about it, feeling hurt, but you also understood you had a job to do. I would also say, thankfully, we also had the opportunity to process. I know when I went back to the EOC, there were opportunities for us to kind of express our feelings, express how we felt about everything that was going on. And so also thankful that I work for an employer that allows us to do that.
If I could add to that, actually, I think for us, it was, that was a huge event on so many levels, obviously on a personal level, but also, as an institution that's focused on public health, there was this real recognition that we've got two converging pandemics here. One is this coronavirus and the other is racism, and that they are inextricably linked, and that, the coronavirus has had a far disproportionate impact on the African American community, the Latino community. And so this, systemic racism, it does have a huge impact on the pandemic that we'd been dealing with over the previous few months. The other thing is that the White Coats for Black Lives movement started at UCSF. And so our students were, very active in it. And a number of our faculty also were really concerned about what we were all seeing in these horrifying protests. And, our ophthalmologists were stepping forward and saying, rubber bullets need to be banned because people are being permanently blinded by them. So, that, and then the tear gas, and the fact that tear gas actually weakens the lungs and scars the lungs and makes you more vulnerable to coronavirus. All of those things came together. So it became yet another layer of messages for us.
All right.
Andy, did you have any kind of quick comment on that, or with the early?
I would just add that, as a Black man, as a man of color, as a brown man, I'm still dealing with this. I identify with all of these guys. I see myself personally. The death of Ahmaud Arbery really hit me. Like I had to actually get off of social media and remind myself, hey, it's part of your job. You have to keep up with it. I couldn't handle it. I'm a runner. I'm constantly running all over San Francisco, and these are the things that every Black person, certainly I do. I have these concerns that I think about. How am I going to respond to this situation if something goes south? I have been in many interactions with the police that have all been amazing, but it's that one, that could go south, and a bad situation that can happen. And then it's not about these isolated experiences, right? It's about systematic institutional racism and anti-blackness that, this nation was founded upon. You think about, how at the very foundation of Jamestown, 1619, this is core to the establishment of the country, and everything that's happening now.
Amen.
It's hard to process, but you have to kind of work through it. You do have a job, and you have to go out and do your job. But this is something that I'm actually becoming more and more hopeful that we can get some good outcomes out of this. For me, I was so proud of Mayor Breed and everything that she's done to make sure that the public is able to exercise their First Amendment rights to protest these horrible injustices in a way that is dignified, that is safe, and advances the cause. I can only imagine the conversations that Francis and the city leadership were in discussing the curfew. And I can honestly believe and know that this was done in an effort to protect people, not to stymie First Amendment rights, because that is one thing that we get done well here, and we have continued to do it, and we continue to lead on. This is how change happens in this country. It's a contentious system. It's a system that's designed for people to come into conflict with each other, but with love. That's how I like to think about it, right? You do it with love, you do it constructively, you don't do it in a way that physically harms people, and the rest of it. The First Amendment, as I like to joke around, but it's true, is the best amendment. It's the first one for a reason. It's here for all of us, and I am so proud of what we have been able to do as a city, and I'm hopeful for where things can go.
Well, we should
Sorry,
have.
that was long.
I'm sorry.
I was just saying sorry that was long. You said to say something short.
Wonderful, thank you. We should have made this an hour and a half or 2 or 3 hours. Thank you so much. Did you want to comment on? We're at the hour. We're past it actually, but did you want to comment on what Sarah suggested in terms of kind of?
How are you preparing for the holiday weekend from your organizational standpoint? And is there a concern about how human behavior this weekend, and how it might complicate things in the following weeks?
Shall I jump in first?
Sure. Go ahead.
We're very concerned. We have 20 patients in our hospital, 20 COVID patients. That is the highest number that we've had since May 5th. We absolutely saw a surge after Memorial Day. It's going to take 2 to 3 weeks to have them all end up in the hospital, and probably 4 weeks for them to start dying. But it is a serious issue. Sorry, somebody's calling me. And statewide, we're seeing huge issues. The San Quentin numbers hitting 1,000. There are security guards who go home to their communities from there. So it's please, everyone, wear a mask everywhere you go over the next few weeks and probably months. But we've reinstated our HICS again after disbanding it several weeks ago. So.
Randy, are you doing anything in particular to help minimize, I guess, people congregating along your area of your domain?
Well, just as this session got started, the mayor's office put out a press release letting everyone know that please celebrate the 4th as you would in a safe manner. Although the fireworks celebration along the waterfront is canceled this year, there are still plenty of other ways to celebrate. You can get together with friends and family. You could do it socially distanced. It's a new way to do things, but there are so many new things that we're doing this year, so it's only in keeping with that. But no, large gatherings along the waterfront are going to be a challenge. And I think to the extent that people are coming back to the waterfront and are able to enjoy it safely, I think that's fine. I think that's great. But the types of gatherings that we're used to celebrate the 4th just are not going to work this year, given what we're seeing in the change of the virus's trajectory. I think 2 or 3 weeks ago we may have been thinking about things differently. We probably still wouldn't have seen hundreds and thousands of people come out like we do every year, but it may have been a different experience. But seeing what we're seeing, we have to continue to be flexible and adapt to the to the needs of the public, given that the virus doesn't care that it's the 4th or Juneteenth or anything. The virus is going to do what it's going to do, and it's on us to make smart decisions based on the best research that's available.
Francis, is this going to be even harder this time around with quarantine fatigue that is really impacting people's behavior?
Sure. You know, it's really up to us on how we get out of or how we kind of stop the spread of COVID-19 and safely reopen, right? This is why, you know, a lot of our effort has really been on educating people on the things that they should do, whether they're going out for the 4th of July, whether they're joining a civic demonstration, whether they just need to be out. They really need to know before they go. And so we are kind of, we launched a micro campaign called Know Before You Go. Really the things that people should know if they're going to go out and be outside of their home. Obviously, it's wearing a face covering, it's maintaining social distance. I can't believe I'm saying this to adults, but wash your hands, and you know, staying home if you're sick. But it's also knowing things like, okay, if you're going to go somewhere, what are their social distancing protocols? If you're going to, do you need to make an appointment? What are some of the measures in place? Who's going to be there? And so really answering those questions so you're well informed about what you're going to do ahead of this. I think as people know on this call, last Friday, San Francisco hit a pause on a reopening. And that's because we've seen a rise in cases. We've seen a rise in hospitalizations. And again, it really kind of falls back to us, you know, if we all wear our face coverings, if we all maintain social distance, then we can really crush this surge and second wave. And so really, I think what we're seeing is there's definitely a sense of quarantine fatigue. So we really have to think about our communications differently. I think earlier on the call we mentioned that you know, that there's a lot of folks that, you know, where government isn't necessarily the most trusted partner. Well, I think gone are the days when, you know, back in March when we could just say, hey, you need to do this, and everyone's going to follow it, right? Right now, we're really getting to a point where we have to learn to live with COVID-19 in our community. And that's not a campaign, that's not a statement, it's behavior change. And so behavior change doesn't happen because we put together a spiffy campaign with excellent graphics. It takes time, it takes buy-in, and we really have to think about the values that people have and thoroughly engaging them as a community in order to strike that behavior change. Because we're really asking people to do things that they're not used to doing, and really getting into their heads that life as we knew it before COVID-19 is going to be a whole lot different. And so influencing that and making sure we have a long sustained effort to change people's behaviors is part of our long-term recovery.
I think we're done.
Yeah.
And now, are you done, Sarah?
Yeah.
Thank you. My goodness, we picked the right panelists. That's for absolute sure. Thank you so much, all of you. It was wonderful, really wonderful. And thank you, Kristen, for answering John Knox's question in addition. So I think we're done. As you all can see, we had lots more to talk about, but it was really a wonderful discussion. So thank you. A word about us. So we are, at 81 years old, one of the nation's oldest PR organizations. And someone here said, how do you become a member? There is a membership information on our website at sfprrt.org, and we'll be sure that we check in with you. One of the things we're proudest of as well is our Philip N. McComb Scholarship Program, which each year raises money for college students who are taking PR and related fields at Bay Area colleges. This year, there were 11 people who actually donated to the scholarship program as part of your signing up for this webinar. And we named 5 college students to our scholarships for this year, and we wrote about them. Brenda Kahn wrote about them on our website, so please look to that. It's quite nice. The winner of our Green Apple $35 gift certificate is Nick Fakari. I'm not sure he was on. If he wasn't, then I will find someone else, but I think he may have been. And the final note, we host an event like this. I mean, this is a new thing. This is our second, but we usually have in-person meetings and will again someday. But they're always like this. I mean, it's really topical subjects and great speakers. And we do this every other month. And then sometimes we meet in person. So we'll try to do that as well. So watch for our information. We have recorded the event, and Phyllis Goodman is writing this up, so it will be on our website, so look for that. We are currently planning a panel on public relations and race, people of color, and we recently posted a statement about our role as PR practitioners and our response to the recent tragedies that jolted our world, which is on our website, and it's titled "How PR Practitioners Can Help Make a Better World." It's a start. We all have to start, right? And you can read that in our newsletter as well. Thank you so much for joining us today. Please let us know what you thought of our event when you receive the survey, and stay safe, and thank you.